Hello, DangTeach at CCSD. Welcome back. And if it's your first time, well, welcome to the community. Today we'll finish our discussion on factors affecting drug activity. If you haven't caught the previous chapter, which is basic biopharmacology, make sure you watch that first before you get into this chapter. And this is part 3, so make sure you viewed 1 and 2 before you get into this one. So for the remainder of this course, we'll talk about, after this, we'll talk about common drugs and their usage. All right, today, as promised, we'll talk about drug-drug interaction and then some drug-diet interaction. Drug-drug interaction. So two drugs taken together, well, you can have an increased therapeutic effect, or they might cancel each other out, or you'll get additional side effects. So every person's different, so their cocktail of medication might interact differently. On absorption, complexiation. So this is going to occur in the digestive tract. And what it causes is it causes the drug to just pass through our body. So complex, it can't get absorbed into the blood supply of the intestines and just pass right through. Certain drugs will affect gastric emptying, pH, so especially aspirin. It's an acid. So if you take aspirin with other drugs, it may affect its absorption. And intestinal metabolism. So we're talking here about the microbes in your gut. What drugs can affect those microbes will affect your ability to digest and absorb nutrients and drugs. Distribution. So now that the drug is already in the blood, displacement will affect its distribution. So displacement occurs with plasma protein. So for example, albumin. So albumin will usually bind Coumadin, warfarin very well. So that's about 98% binding. However, if you take some aspirin at the same time as warfarin, albumin likes to attach to aspirin more than it does to warfarin. So effectively, you're going to get an increase of warfarin, free active warfarin drug concentration in your body. And it only takes a little bit of aspirin to kick off a little bit of warfarin to magnify the effects. Maybe it's twice as much in your blood, 3 times as much. It just takes a little bit of aspirin. So of course, no aspirin if you're on Coumadin or warfarin therapy. Enzyme induction. So if you always have a drug in your system, your body's going to adjust. Your liver's going to say, hey, there's always this chemical in the environment. I always have to break it down. So why don't I make more enzymes in preparation to break down that drug? And this is a very common example with alcoholics. So for alcoholics, they're going to produce a lot of those liver enzymes that break down alcohol or metabolizes alcohol. So their liver produces a lot of these enzymes, alcohol dehydrogenase, acetaldehyde dehydrogenase. Whereas if you don't drink at all, your body's not going to waste its time making these enzymes to break down alcohol. So in the alcoholic, you'll get a reduction of the pharmacological effect. That means they'll need to drink more and more alcohol just to get the same effect. Enzyme inhibition. This is very similar to protein binding in the blood that affects distribution. However, since this is affecting metabolism, right, this is going to occur in the liver, right? So we have the liver enzyme, So here is the liver enzyme. And normally it attaches to drug A and it breaks down drug A. However, if you take a second drug, let's say drug B, then the enzyme is more attracted to B. It'll break that down more and it'll release drug A, the first drug you were taking. So while the enzyme is occupying breaking down B, there'll be more drug A free to interact with receptors. Drugs affecting excretion. So affecting the kidneys, well, one thing that affects the kidneys outright is blood pressure. So there are drugs that will increase blood pressure or decrease blood pressure. For example, if you take a decongestant like Sudafed, that's going to increase your blood pressure and going to affect kidney filtration. Other drugs will relax blood vessels, reducing the pressure through the kidneys. We already mentioned about the pH effects of urine on acid and basic drugs. So a quick review of the pH scale. It ranges from 0 to 14. Low pH is acid, high pH is base, and in the 7 is neutral. So remember, opposites attract in this case. So if your urine is basic, it's going to suck in acid drugs, eliminating that quicker. If your urine is acidic, it's going to suck in basic drugs, eliminating those basic drugs quicker. Which of the following is affected? Absorption, distribution, metabolism, or excretion due to these drug-drug interactions. So first we'll need to identify, and then we'll see if it increases or decreases AD-emery. So renal secretion, and that's going to be, of course, excretion. So it didn't really tell us what's going on. We're just identifying, I guess it's in the kidneys. Gastric pH. So anything that's too basic or too acidic will definitely decrease absorption by breaking down the drug. Enzyme induction. So where does enzyme induction occur? So if you said liver, you would be correct. Displacement. Where does displacement occur? Yep, that's going to be in the blood. So remember, blood proteins will bind drugs, and there's only a little bit of free drug to interact with the receptor. However, you take a second drug and it kicks off that first drug, now there's going to be more in your system. Complexiation. So this is absorption. Here we're talking about the drug combining with another drug. So for example, many antibiotics, you should avoid not heavy metals. You just avoid metals like calcium. They'll bind with your antibiotics and make them inactive. Glomerular filtration, of course, occurs in the kidneys, so that's going to be excretion. Intestinal metabolism. Is the drug in the blood yet? If it's still in the intestines, it's not in the blood yet, so that's going to affect absorption. And lastly, urinary reabsorption, that's in the kidneys, so excretion will be affected. Drug-drug interactions. When taking two drugs together, you can have an additive effect, where one drug plus another drug will equal to, if you take them individually. Synergism is another effect, where they kind of amplify each other's effect, and 1 plus 1 might equal 12 times or 20 times the effect of each drug if you took them individually. Then we have potentiation. One drug will increase the activity of another one. So Abilify is a common potentiation drug. So if you're on antidepressants and they no longer work as well they used to, you can take Abilify on top of it and it'll help out your antidepressant. And of course, the antidote, a drug that blocks the action or reduces toxic effect. So for opioids, the common antidote is Norcon. They'll prescribe that to heroin addicts and even family members of heroin addicts. And I think first responders, firemen, police officers, they'll also have Norcon to deal with our opioid epidemic. Drug-diet interaction. So your food can interact with the drug. So yes, chemically. So if your food is acidic and your drug is basic, they might affect each other. Improve solubility. So fats. So if your drug is fat-based, then you should take it with some fatty foods to help aid absorption. If you take fat-based drugs, but not taking it with any fats, it may not absorb. Like your vitamins, A, D, E, and K. You'll need to take that with some kind of fats. That way you can absorb it. Alter gastric emptying time. So definitely coffee, black pepper, I think chocolate, alcohol, wine. Those things delay gastric emptying. So that's going to reduce absorption. Intestinal motility. Foods that you eat that control the rate of your intestinal movement. And the main one is fiber. So if you have no fiber in your diet, you're going to have a very slow motility. If you have more fiber, there's going to be more water, softer stool, and hopefully more regular bowel movements. And then altering blood flow. Food that alters circulation or dilation of blood vessels. So garlic, ginger are known for its effects on the circulatory system. And if you eat spicy foods, that's going to increase your metabolism, so blood flow is going to increase. On distribution. So I mentioned that when you increase your protein, that's going to increase metabolism. So this is the goal of the Atkins diet. So the way the Atkins diet works is we can't store protein. Any excess protein we have to metabolize and excrete through the kidneys. So if you're eating a lot of protein, then your body has to constantly work to break it down and excrete it. Opposite, if you increase your carbs, your body, I believe, goes into storage mode. So there's a lot of excess carbs. It gets stored into glycogen, and then if there's excessive amounts, they'll store it as fat. And then if you increase your fat, there's no effect. So this is the ketogenic diet. So it's a large fad currently where you're eating high amounts of fat and you're converting your body into a fat metabolism instead of a carbohydrate metabolism. And this doesn't cause any spikes and troughs in blood sugar. Your blood sugar should stay relatively stable if you're on this ketogenic diet. Decrease calories, your body's going to go into starvation mode. So it's going to store all of the energy that you take in. So metabolism will affect distribution, how fast the drug will get to the site of action. On excretion. So if you increase your protein diet, as in the Atkins and even in the ketogenic diet, you're going to increase the amount your kidneys need to work. So you have to always excrete the excess. That means if you're always excreting, you'll have less time to secrete the waste that's accumulating, and it's harder to reabsorb. In this case, mostly water that's reabsorbed. Definitions, review questions. Which of the following describes the additive effect? Yep, B. So we got 1 plus 1 equals 2. Synergism. If you said D, you are correct. This is when 1 plus 1 might equal 50. 50-fold increase in activity. Potentiation. Potentiation is abilify. So if your antidepressant meds no longer work as well, they'll put abilify, and hopefully that will help out your antidepressant med. And an antidote blocks the reaction. Norcon, of course, is the common antidote for opioid overdose. All right, that brings us to the end of factors affecting ADM&E. So next week, we're going to get into common drugs. Next 2 weeks, we're going to get into common drugs and their uses. So stay tuned. Until then, I'll get them up as soon as possible for our following week. Again, thank you for joining us, and you have a wonderful day.